Welcome, everyone, to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, there are thousands of people in this country who are disabled because of injuries to their spinal cord or their brain. It's the result of trauma, a stroke, cerebral palsy at birth, or even an infection. But what's not widely known is that there are surgical procedures that can often help these patients to improve their quality of life and also their function.
I had no idea.
Well,
We're going to find out.
I'm glad you're here.
That's right. Joining us in studio is Mayo Clinic orthopedic hand surgeon Dr. Peter Rhee and one of his patients, Bret Dzubay, and Bret's father, John Dzubay. Welcome to all of you.
Thank you.
Thanks. Welcome, Dr. Rhee. Nice to see you.
Good to see you, sir.
Also, Mr. Dzubay, Bret Dzubay, thanks so much for being with us. So let's start with you, Dr. Rhee. Tell us about your work and how you got involved with patients like this.
Well, we have a multidisciplinary practice here where we evaluate and treat patients that have had a brain injury or a spinal cord injury. And it really stemmed from my experience when I was a hand surgeon in the Air Force, taking care of young patients with brain injuries. And admittedly, I really didn't take care of patients at the time with stroke, cerebral palsy, or spinal cord injuries. And it wasn't until actually my dad had multiple strokes, and he ended up with hemiplegia. His arm got
Meaning partial paralysis of half of his body.
Yes, sir.
Yeah.
And then contractures that developed, and then unfortunately my oldest nephew became a spinal cord injury patient too, and a lot of things that even as a Mayo trained hand surgeon, I didn't realize there were things that we could do until I had a personal vested interest in it. And I thought, boy, there's a lot of things, but why aren't we doing it? So that's what we started.
And when you say contractures, you mean that the joints become stiff and you can't move them?
Yes, sir.
And that's the problem?
Yes, and that's typically drawn out by the fact that when you have an injury to the brain or the spinal cord, there is a reflex mechanism in your muscle, and it becomes unchecked. And the muscles get a little tight, they are overly active, and then it draws the deformity in the arms or the legs. And after a long period of time, the joints can get stuck in that position.
So you said to yourself, there must be a way I can help these patients?
Yes, sir.
And that you figured out operations that could improve their function?
Yes, sir. And those procedures have been around. It's just not done with much frequency. So it's and a lot of that information is pretty old. And so now we're coming up with new innovative techniques to help advance the rehab for patients.
All right. So Mr. Dzubay, let me ask you. You're Bret's father.
Yes.
And when did you first know that Bret had a problem?
Well, before he was a year old. He wasn't developing quite the way we thought. And we thought, maybe he's still a little slow or something, but we eventually went to a doctor and they gave us the diagnosis that he had cerebral palsy. And
it wasn't until a year old that you knew that.
Yeah. And we had no idea what this was going to be in our lives, what it means, and it's a huge challenge. So. And
what did you find most difficult in trying to care for Bret when he was younger?
Well, when he was younger, it wasn't so bad. The spasticity in his arms and legs gets worse with time. So the older he got, the more stiff he became, and the less things he could do. When he was real little, he could pick up a fork and spoon and feed himself, and then that went away, and he was never able to walk. In the beginning, he was kind of working on that, but that ended up so you just keep finding out more and more things that he couldn't do, I guess.
What became the biggest challenge then in caring for him? Because not only, he's growing up during that time too.
Right, yeah. When he was younger, it wasn't so bad. Once he became more of an adult, that's when dressing him became hard. His arms were up here, his hands were clenched. It was hard to cut his fingernails. It was hard to get him dressed. You couldn't get shirts over his arms. That was very difficult. Going to doctors, they couldn't get an armband around to check his blood pressure. Taking blood was difficult. Cutting his fingernails was hard because his fingers were just a lot.
So he had severe contractures, basically, of his arms, his elbows, his wrists, his fingers.
Everything, yeah.
And got worse as he got older.
Right. Yep.
Were you aware at all that there might be some surgical procedures that would help him? And how
No.
did you end up with Dr. Rhee?
No, I mean, we've been doing procedures. Bret's had so many operations over the years on different things. One of the things we were trying to relax him was Botox injections in his arms, which is this big needle that goes in, and supposed to loosen things up. We tried that several times, wasn't working, and that doctor suggested Peter Rhee for us.
I just want to know, Bret, is it painful when when his arms are pulled up like that? Is that painful for you?
Yeah.
Yeah.
Yeah, I mean, when you're up like this all the time,
Yeah.
he's in pain a lot.
So how can you help him, Dr. Rhee? What did you do?
Well, we always try to start with non-surgical methods, and Botox is one. There's medications, even baclofen pumps, which is a medicine to decrease the spasticity. But when it gets this severe, like Bret's left arm, it's really tough for splints to work. It's just, like you said, it gets to a point that it's so severe, it's hard to do all your basic needs. And so pretty much the philosophy is this. If there's any control in the arm, that Bret can actually do anything with the muscles, we try not to take that away. We just try to get the joints positioned in a better way, so whatever function he has, we can just enhance it. Or if there's no function whatsoever, then it's just to get the arm and the elbow and the hands out in a better position for hygiene purposes. And our motto in our clinic is, if we can just position Bret's arm better, then other people can take better care of Bret. And so the techniques are pretty unique. It's either lengthening muscles, releasing the joints, manipulating the nerves, but the basic principles are not to take anything away, but to help with just quality of life.
So what did you do to his arm?
Actually, Bret, buddy,
in 90 seconds or less.
Okay.
Yes.
In 90 seconds or less, we fixed the contracture, which I think visually you can see the left arm and the right arm were almost identical. And so now Bret, involving multiple plastic surgery type stuff in the elbow, preserving the function. Bret, can you bend your elbow up and down? So trying not to take anything away, but then getting his fingers out of his palm, the wrist straight. It's a lot of work. Bret and I spent a lot of time together. Most of the time you were asleep though.
Yeah. How long was the surgery?
Well, this surgery took us close to about, I think 6 hours or so. Traditionally, what's done in multiple stages around the world, we do it all very safely in a single surgery.
Wow, pretty incredible. So when you learned about this and talked with Dr. Rhee, were you gung-ho, or were there some concerns on your part, Mr. Dzubay?
Well, it's not me that has to be gung-ho, it has to be Bret.
Yeah?
I mean, Bret has to be the one that decides if he wants the surgery or not. And long story short, he's had 18 to 20 surgeries. Some have been really good, some have not gone well. A lot of his recent ones, the doctors say, we'll do this, and he comes out worse. So he was not up for this. He didn't even want to see Dr. Rhee. And so we finally had to, we just kept saying, he's not going to make you do anything, just, if you want to, just go in and listen to him. When he did listen to him, Peter just won him over with his personality. Bret wasn't immediately saying, yes, I want to do it, but he made it seem so confident in what he was going to do that Bret eventually agreed to it.
And folks can see, if they're watching our YouTube video, they can see the difference in Bret's arms. If you're just listening on the radio, I will tell you Bret's right arm looks relaxed, and your left arm still does look like it is painful. Bret, are you going to do your left arm, or are you just going to leave with your right arm? Are you going to come back for another surgery?
Maybe.
Maybe.
Do you think stick with Dr. Rhee or find someone else? Yeah.
Stick with Dr. Rhee. That sounds good.
Yeah, he's terrific. We've been talking with orthopedic upper extremity surgeon Dr. Peter Rhee and his patient Bret, and Bret's father, Mr. John Dzubay. I guess for patients who become disabled from brain or spinal cord injuries, there are surgical procedures that can improve function and quality of life, and I think you've proven that, Dr. Rhee. It sounds like those surgeries maybe should be done more often and more people in the hands of an expert like you.
Yes, sir. I think that people that dabble in it, there's a lot of things that you make one change, there's a downstream effect. And unless you've had the experience, you can definitely hurt people, like John said. And so I think it's good to come to a place that has a great team with multiple different providers.
Yep. And first, do no harm.
Yes, sir.
Bret Dzubay, Mr. John Dzubay, and Dr. Peter Rhee, thanks so much for being with us. Really enjoyed the conversation.
Thank you very much.